How are you feeling about today? Totally understand. Everybody, I think, is a little bit nervous prior to getting fillings, but I can promise you we will do everything we can to make it as unstressful and, oh, come on, comfortable as we possibly can for you, okay? Yeah. I remembered from last time that you had elected to have some nitrous, so we can definitely do that. I have all of that prepared for you, okay? So, we are doing these 2 molars where you can see it lit up. Those are the teeth with the cavities. Just need to get a mask out. Just move my hair on my ears here. Alright. Real quick. Just gonna have you rinse for me, okay? Thank you. Alright. So, I do like to start by just sort of feeling around the jaw, the throat, and your mouth. Just making sure there are no signs of swelling. Sometimes an issue with our dentition can lead to external swelling as well, particularly if an infectious process is present. So, just like to rule all of that out so we can get a really clear picture of what's going on. And so we can also extend the best treatment for you possible. Okay. I'm not feeling any inflammation or swelling in the cheeks or the jaw. Neither supramandibular or submandibular. any pain or discomfort in these areas? Okay, not that you're aware of, okay. From an external standpoint, everything looks good, so that's good. Real quick. Just gonna use my light so I can take a look at your tongue and the buccal mucosa inside of your mouth, inside of your cheeks, okay? Yep, open up for me. Beautiful. Okay. Good. Everything is a nice pink. I don't see any pallor or angry redness to be concerned about. Over there. So, as always, you get to pick the color of your clip. I believe last time you chose orange. Did you want to go with orange again or try a different color? Yeah, we can do blue. Some of these are a little bent on the stiff side. Just want to make sure that our bib here is covering you appropriately so there are no drips or anything on your clothing. You're wearing a really nice shirt, so we want to make sure it stays nice and protected. Okay. Alrighty. Just my light on here. Just going to position this like so. Okay. So before I lie you back, initial look inside of your mouth, okay? Okay. Let me just have you open for me. And I'm just going to use my mirror. Just making sure there's no gum irritation involved. Okay. Alright, you can relax. So, I'm going to get your nitrous started and then we're going to lie you back, okay? Quick. First, I'm just going to like this around your ears. So make sure your hair is out of the way. So that should start flowing. Should make you feel a little bit floaty and lightheaded. But if you start feeling nauseated at all, let me know, okay? We can adjust as we go. Is that okay so far? Good. Okay. So I'm just gonna move my stuff over. And then we're gonna get you lying back, okay? Okay, so just shifting my weight overhead. Is that okay? It's not in your eyes too much. Okay. Just need to make sure that I have a good visual of what we're doing here. Are you okay lying down like this? Okay. There's no strain or anything on your back. Okay, good. If at any point that changes, let me know and we can readjust, okay? Okay. So, real quick, can I have you open up for me? Thank you. I'm just going to place these here. taking a look at where we're going. Alright. Actually, I'll just set my mirror here right next to your head. So, first thing I'm going to do is just use a topical numbing agent to numb the area around the tooth. And you said you like to know what's going on, so I will continue to inform you. Okay, let's have you open real wide again for me. Give that just a moment. Can you feel that? No? Okay, good. Okay. Open up really wide for me again. that should start getting you pretty numb pretty quickly, okay? Just open up. I'm just gonna slide this. Right. One more here. So, I'm gonna test your tooth, okay? Yeah, the area around it. Can you feel that? Good. Alright. So then. Okay. So my drill is a little bit loud, okay? So if you at any point decide that you would like to have some earphones, let me know, okay? Okay. Okay. So I need you to open really, really wide for me, okay? Okay. Open up real wide again. Almost there. Last go here. Open the wide. Take a look, so you can just open up for me one more time. going to remove the cotton rolls and switch them out for new ones, okay? That right back in here. How are we doing? Are you still feeling numb? Okay, good. So now I'm just gonna go in and start filling, okay? So this part is pretty benign. Now I'm gonna go in and cure it. Open up real wide again. gonna have you write down on this for me, okay? Yep, grind a bit. Okay, so we are going to need to file this down just a bit. Open up. Okay. Let's have you bite down again, okay? Grind. Alright, a little bit more. We're almost there. Okay, open up real wide again. Last time, I promise. Yep, good grinding. Really grind your teeth on it, okay? Because we want to make sure that your jaw can close comfortably. And your teeth are fitting together comfortably as well. Good, perfect. Okay, you give me again. Almost done, I promise. Yep, you can relax. Just gonna dab just a little bit of drool. It happens because you can't feel your mouth or your jaw. So just relax your jaw for just a moment. Okay. Last time I'm going in. Promise. Okay. So, just taking one last look. So, everything looks good. I'm just gonna move my light out of the way here. So then we're gonna go about it slowly, but I'm going to sit you back up in just a couple of minutes, okay? So, how are you feeling? You feeling okay? Not too lightheaded? Okay. And then we should be okay to sit you up. Just a second here though. While you're not feeling any excess swelling or Very good. Side. Okay. So nice and slowly, let's sit you back up, okay? So. Let me get this moved out of here. And I'm also going to remove your bib. Set you over here to be sanitized. Okay. So you did great. I know it's not easy. It can be quite a bit terrifying and uncomfortable. I totally understand. So I want you to refrain from any kind of chewing gum or even smoking, using a straw, anything like that for the next few days, just to make sure there are no issues with the fillings, okay? If you start feeling any pain in the areas outside of some soreness, if you start feeling a shooting pain or a sharp pain, any kind of burning, I want you to let me know, okay? Okay. So then, until the effects of the nitrous wear off, I want you to stay here, okay? Just for a few moments. I'm going to have a dental assistant come in and check on you, and they'll let you know when it's okay to leave, alright? But we want to make sure that you're safe and there are no issues, particularly on the drive back to work or back home, so that's why we want you to take it really slowly. Okay. Do you have any questions for me before I step out? Okay. Well, if you think of anything before you leave, just have one of my assistants grab me and I will pop back in. Okay. It was really nice to see you today. I'll see you when you come in for your next